Okay, so what I'm going to do here is I'm going to show Dr. Aida, who's going to be my GP clinical supervisor today. And I am going to show her a mock consultation of me with actually one of my colleagues, but pretending to be a patient. And I want some tough feedback on how the consultation's going and how I could improve. Are you happy to do that, Dr. Aida?
Absolutely. I'm happy to help and provide feedback. Let's get started with the consultation, and I'll offer suggestions as we go along.
Okay, sounds good. Don't be too nice. I want you to give me a hard time. I really want to learn.
Got it. I'll be as constructive and thorough as possible. Let's dive in.
Agreed to be pretend patients. So none of this is true. We better give you a name. What do we call today?
Rose.
Okay, Rose, you are. So what brought you in today, Rose?
Well, for the past few days, I've been having headaches, and I've been craving for a lot of sweets, and I've been drinking a lot of water, which is fine.
Okay, I'm just going to stop there. Dr. Aida, just as a differential diagnosis, what are you already thinking from the very beginning of this consult?
Based on the initial symptoms, headaches, craving sweets, and increased thirst, I'm considering possibilities like diabetes or another metabolic condition. It's good to explore these symptoms further to narrow down the diagnosis.
Okay, I'll press on.
Because it's quite hot outside, but then I do have a family history of diabetes and hypertension in the family.
So who's got diabetes and who's got hypertension?
Mom and dad both have diabetes.
Right, okay, so that's something we need to be a bit careful
of. Yes.
And we're a bit suspicious with all this urinating a bit more often. Any pain when you're going, or pain in the kidneys or anything?
Pain at the back sometimes.
Pain in the back sometimes,
yes.
Yeah. How long have you been? How am I doing, Dr. Aida?
You're doing well, particularly by exploring the symptoms further and asking about pain or other associated symptoms. It's also good that you're acknowledging the family history and considering it in your assessment. Keep up the good work.
You seem like you're just being too nice to me. Give me some critical feedback. What could I be doing better? How's my rapport with the patient? How am I doing?
Your rapport is good. You're making the patient feel comfortable. One area for improvement might be to ask more open-ended questions to gather more comprehensive information. Also, consider summarizing the patient's concerns to ensure you're on the same page.
Okay, they sound good tips. Could you give me an example of an open-ended question I could be asking?
Sure. You might ask something like, can you tell me more about how these symptoms have affected your daily life? Or what changes have you noticed recently in your health or habits? These questions encourage the patient to share more details.
And what did you mean by summarizing back to the patient?
Summarizing means repeating back what you've understood in your own words. For example, you might say, so from what you're telling me, you've been experiencing headaches, increased thirst, and a craving for sweets over the past few days. Is that correct? This helps confirm that you're both on the same page.
Okay, sounds good. Let's keep watching. What do you think?
Possibly.
Sounds good. Let's continue.
2 weeks now.
Okay, have you been thirsty?
Very thirsty, so that's why I decided to just have myself checked.
Good idea. Vision okay? No problems with that? Blurring?
I do wear glasses.
Yeah.
And it does run in the family as well, so I'm not sure if that's part of it.
Yeah, okay. And we haven't met before. Have you had any past medical history, any problems with your health in the past?
Not
You're
really.
doing
It's the first one, yes.
Sorry, Dr. Aida, you said something there?
Yes, I was noting you're doing a good job exploring the patient's medical history and current symptoms. One suggestion is to ask about any recent changes in her health or lifestyle that might be contributing. Keep encouraging her to share more details.
Like what sort of things?
You might ask about recent changes in diet, exercise, or stress levels. For example, have you noticed any changes in your diet or exercise routine recently? Or has there been any increase in stress or changes in your routine? These can provide helpful context.
Okay, that sounds good. Thanks for that. Healthy on your medications? You on the pill or any other tablets for anything?
Just supplements.
Just supplements.
Vitamin C.
Vitamin C, yep.
Vitamin D supplements.
Yep.
Multivitamins.
Okay.
I think that's it.
Allergic to any medicines?
Not that I know of.
What do you reckon, Dr. Aida? What do you think about all the vitamins and supplements she's on?
It's good that you're clarifying her medication and supplements. It's important to know about them as they can influence her symptoms or interact with other treatments. You might want to ask about the dosage and how consistently she takes them, as well as why she started them.
Okay, can you give me an example of how the supplements could be relevant specifically to her?
Sure. For example, if she's taking vitamin D supplements, you might want to know if she was previously deficient or if there's a specific reason for them, as this can indicate other health issues. Also, high doses of certain vitamins can sometimes cause symptoms, so it's good to check for any possible links.
Sometimes patients are on really strange alternative sort of treatments. Do you think that I should confront her about those, that they're not scientific, or just let it go?
It's important to approach it with an open mind. You can ask why she chose those treatments and discuss any potential benefits or risks. It's best to educate her on evidence-based medicine while respecting her choices. Building trust is key.
Okay, so I probably would just let it go at this point. Does that sound all right?
Yes, unless there's a safety concern. You can note her use of these treatments and gently offer evidence-based advice if it becomes relevant. Building a trusting relationship is the priority.
Okay, we'll press on. Okay, good to know. All right. Anything else that you've noticed with your health recently, or you were pretty good until 2 weeks ago?
Surprisingly, it was just 2 weeks ago that prompted me to come here and get myself checked.
Okay, well that makes a bit of sense. That's really helpful. Okay, so obviously it's a good idea for us to do a urine test.
Yes.
And we're going to do a blood sugar test.
Yes.
With a finger prick. We've got excellent nurses here who could do that. Were you seeing a doctor before you came here? Because your first time at our clinic, have you been seeing another GP somewhere?
I have been, and unfortunately they were unavailable.
Okay,
Yes.
all right. Well, if you keep coming here, we might have to get the notes and
Yes.
just check what's, any past history. Have you been running any fever, any temperature, anything like that?
Not in the last couple of weeks.
Great. And any travel recently?
No, just emergency.
Not so often. All right. Do you smoke?
No.
Okay, drink much alcohol?
No alcohol as well.
And what's your social setup? Are you living on your own, or you in a relationship, or what's your situation?
So I have a toddler and I have my husband with me.
Oh,
so
lovely.
it's just the three of us.
Beautiful. And your husband's well, and your
Yes,
child's
he's
well.
Yes.
Are you vaccinated up to date? Do you know if you've had everything
I
this year?
think just the most recent COVID vaccine.
Yep.
I haven't had it because I had COVID about 2-3 months ago.
Oh,
So I'm
right.
not sure if I'm eligible for that as well.
Okay.
But other than that, I think all my vaccines are up to date.
Okay, well that sounds pretty good. Do you generally get... So Dr. Aida, what do you think now? How's the consult going? Any gems or criticisms or constructive points?
You're doing well by covering a broad range of health and lifestyle topics. It's great that you're asking about vaccination status and recent illnesses. One suggestion, you might want to delve a bit deeper into her recent illness and how it might be affecting her current symptoms. Keep the conversation flowing as you are.
What do you mean, delving into her recent illnesses?
You could ask how severe her recent COVID infection was, if she's noticed any lingering symptoms, or if she feels fully recovered. This can help you understand if her recent illness might be impacting her current health.
Yeah, okay, good suggestion. Let's keep looking. The vaccine as well?
Yes,
Yeah.
every year.
And your women's health check, do you do pap smears and things like that along the way with your past GP?
Yes,
Yeah, but do you know when your last one was roughly?
5 years ago.
Okay, well that's something else. So we won't try and do too much today,
Okay.
but that's really helpful and you've explained everything really well. So, today we'll get your sugar test, We're certainly going to get a blood test done for you. I think that might be a good idea. And also, when we finish chatting, I might do an examination. So let's pretend we're doing your exam, and we check your temperature, and you're afebrile, 37 degrees, poke your tongue out, you're a little bit dry, chest sounds good, and we'll just do a dipstick chest test on your urine. So Dr. Aida, what do you think about my examination, and what things should I be looking for?
Your examination approach is thorough. It's good to check vital signs and do a general physical exam. You might also look for signs of dehydration or any other abnormalities. It's also important to observe for any specific signs that might relate to her reported symptoms, such as signs of anemia or thyroid issues. Keep up the detailed assessment.
Yeah, looking back on it, she had said she'd had a bit of back pain, so I feel like it was a bit of a miss not to do an abdominal examination and just check she didn't have any kidney pain. What did you think?
That's a good observation. Including an abdominal exam to check for any tenderness or kidney pain would be beneficial, especially given her symptoms. It's great that you're reflecting on areas for improvement.
Yeah, again, you seem like you're being nice. What if you were giving me really harsh review? If you were a really tough, possibly mean supervisor, what would you tell me about that I could improve?
If I were being critical, I might say, be more thorough with your physical exams and ensure you explore all potential causes of symptoms. Don't miss important steps like checking for kidney issues if the patient mentions back pain. Always be comprehensive in your differential diagnosis and cover all possible areas. But overall, you're doing well.
Yeah, I guess in general practice, you've only got 10 or 15 minutes, so we've sort of got to prioritize things.
Absolutely. Prioritization is key. Focusing on the most relevant symptoms and potential red flags first can help you make the most of the limited time while ensuring comprehensive care.
Okay, so we'll press on. Oh yes, you do have a bit of sugar in your urine, so we definitely are a bit suspicious about diabetes, but we'll have a look at that.
Okay.
Lots of information today. Did you have any questions for me?
Not at this stage.
So if you were the patient, what would you be thinking at this point, and what questions might you have for me?
As a patient, I might be wondering about the next steps, such as what the blood test results could mean or how to manage symptoms in the meantime. I'd also want to know how serious the condition might be and what lifestyle changes I might need to consider.
Okay, fair enough. Let's press on.
Wait for the results.
All right, well, we'll stop there. Okay, so that was basically the consult. Again, any further points, or maybe you want to summarise back what I'd done and maybe summarise back also the feedback and how I can improve.
Overall, you did a great job building rapport, asking relevant questions, and performing a thorough examination. For improvement, consider being more systematic in addressing all potential causes, especially with reported symptoms like back pain. Continue refining your approach to include all possible differential diagnoses. Keep up the good work.
Speaking of that, what are all possible differential diagnoses?
For the symptoms described, headaches, increased thirst, and craving sweets, differentials could include diabetes, dehydration, thyroid disorders, and possibly kidney issues. It's important to rule out metabolic or endocrine disorders and consider other causes like stress or dietary factors.
Really? Why did you think thyroid? That wasn't really on my list.
Thyroid issues, particularly hyperthyroidism, can sometimes cause symptoms like increased appetite, weight changes, and sweating. It's less likely here, but still worth considering in a broad differential, especially if other symptoms point that way. It's good to keep a wide scope when diagnosing.
What are important rare things not to miss in this sort of case?
In this scenario, important rare conditions to consider might include adrenal insufficiency, certain metabolic disorders, or even a paraneoplastic syndrome. Although these are less common, it's crucial not to overlook them, especially if initial tests don't explain the symptoms. Keep a broad differential in mind.
Okay, that was very helpful. And thanks for all the feedback. Great session.
You're very welcome. I'm glad I could help. If you have any more questions or need further assistance, feel free to ask anytime.
Okay, bye.